Now, tonight's subject is more on conscious deep breathing. This is a subject that's been percolating through in my mind and my awareness over the last few weeks. The story really began back in March when I went to Stanford University to learn the Empowered Relief teachings and workshop that teaches binaural meditation. And that's just a form of meditation that you listen to with slightly different frequencies in both ears that alternate. And as you listen to this audio file, either on YouTube or from the workshop, you can hear, whether it's consciously or unconsciously, the slightly different beats from left to right, and that helps to encode the learning, and in this case, learning to relax and meditate, and therefore enhance the whole process of switching your nervous system from the sympathetic drive, which is so common in our busy culture where people are working or got extremely hectic personal lives, and we're not sitting down and relaxing. We're not kicking back and chilling out enough in order to help our nervous system. This is really a nervous system problem that we can actually control. And the amazing thing with the study at Stanford is they showed not only pain reduction in negative mindset, thinking associated with pain, and also on functional MRI scanning, an increase in the size of the brain areas where chronic pain is controlled, in the neocortex, which is the larger part of the brain around at the top. So they were able to show these changes on functional MRI scans, which did reflect patients improving. Now, the second aha moment was really with my trigger point injections, where I poke people all day, every day now, and get lots of good outcomes. My audits have shown excellent results for most people. And really what that's about is relaxing tense muscles. And just like the switching of the nervous system goes from sympathetic to parasympathetic, you get a reduction in muscle tension. Well, that's exactly what happens with trigger points. And also, you get an increased blood flow through the autonomic nervous system to those areas that are in pain or are tight. Again, that's what happens to people with needles and inject them with trigger point injections. So these are two things that have been correlating together, and you think, yeah, it's really essential that we get our bodies into a state of relaxation. But the question is, how do we do that? And if I say to you, right, just relax, okay? Just go and relax. Like, hello, that's not going to happen. We're so busy. We've got iPhones going off. We've got smartphones going off. We've got computers, emails to follow up on. We've got family commitments. We've got job commitments. We've got bills to pay. And it's kind of go. So how do we get a change from the inside of our brain and our nervous system to flip into the relaxation mode? And today I was inspired by Dr. Jen Fitt, Doctor of Physical Therapy in LA. I interviewed her for my podcast show, and she drove home this message that really hit a chord with me. And it was this: be able to breathe consciously, to switch the nervous system over on an ongoing basis if we're going to have success with the therapies that we're doing. And although I've known this, and I do talk to patients, and currently I'm advising, every hour for 3 breaths, stop, pause, slow deep inhale through the nose, and slow exhale through the mouth. That's a good starting point. But what I got today was, people need to do this even more. Reality is, we're just doing all these different things, and we're trying to make the best of it. But at the end of the day, whatever time you've got available, I think we should be spending all our time doing this. Maybe you're off work. Maybe you've got 2 hours to kill in an afternoon or a morning. Sit down for 2 hours, or lie down on your bed or on the couch, get comfortable, and breathe consciously for 2 hours. Maybe some of my viewers are retired. Maybe they've got more time, even more than 2 hours a day free. There's 4 hours doing it. Why not? Why not take the bull by the horns and start to engage in a huge way in the nervous system and switching it from the sympathetic to the parasympathetic? Because I think in all reality, the more time we spend doing this, the better the outcomes are going to be. And if you're slow, deep breathing, bring it deep into the abdomen. Relax that diaphragm as you deep, slow inhale feel the relaxation in the body. Feel the diaphragm going down. Automatically your belly will stick out, but it's about the relaxation of this technique that is so important. I can't emphasize enough. If we're going to master pain, we've got to spend a lot of time with the deep abdominal breathing, because that's the one thing that you consciously can do right now if you're in a safe environment to slow that heart rate down, reduce the tension in the muscles, and increase blood flow to the same areas. And also calm the mind of negative thoughts. So if you are doing this for a long period of time, don't worry about the thoughts. They will naturally get calmer over time. Always bring the thought back to the breath and slow, deep breathing. If you want to add extra fuel to this, plug in from iTunes binaural. It's binaural, binaural meditation. Do it for 20 times. Do it twice a day. Do it 3 times a day if you've got the time. Why? Because it encodes the learning of relaxation of the body. So these are lots of modalities on how to optimize this autonomic nervous system and make it work. Because at the end of the day, you control your outcomes, you control your destiny, and we have got that ability to sit down and do these exercises. So one thing I want to add to this, because not only is it good for pain, it's good for several other things that prevent us from healing. And this came up today in a couple of cases with patients. One, fear, the fear of movement. If you're really fearing movement, you're not going to do it. And if you are going to do it, then the fear will trigger the contraction of the muscle, the reduction of blood flow, the increase in pain, and then you're going to not do it because of the fear. We need to embrace that fear. And the deep, slow breathing will help that a lot. And also anxiety. Anxiety stops us doing things. Oh, well, I can't do a few things because it might hurt my back. Well, do things slowly with intention and see if you're okay. And if you're okay, do a little more and increase wherever you are. Increase what you're doing up and embrace that anxiety, embrace the fear, and use breath work while you're doing it to negate or at least reduce the level of pain and suffering during the activity. So breathing helps a wealth of different things if we just jump into it and embrace it. So these are my thoughts tonight. I'd like your comments, please. Send me a comment on Facebook here. Do a like, do a share, and give me a question. What would you like me to talk about? And this week was definitely an inspirational one for me, where it all kind of came together, and being able to share that with my patients of how do we really change the nervous system? How do we really reduce pain? And at the end of the day, I think the answer is in our hands, and we need to embrace it fully. So that's it over for today. I hope you liked it, and I look forward to next week for my next live stream here on Facebook and hopefully Instagram too. Okay, thanks so much and have a great day. Bye for now.